all the factors like obesity and sleep apnea, hypertension, the smoking, all those things come into play, and then you actually started to develop the
I just.
Thank you. There's a question that came through from chat, and that is there any modality such as intrauterine ultrasound that would be able to pick up this cardiac anomaly before birth?
I don't think that I'm aware of any ultrasound modality that can pick up this anomaly in intrauterine life. So I'm not aware of anything like that.
Okay, thank you so much, and thank you for being with us late afternoon. Yeah. Well, okay, it is late afternoon, and thank you for everybody that's present with us. There is the second general session of this SMA annual meeting. There are two very big things that are occurring. One is the ceremony of turning over to Dr. Christopher Morris, a rheumatologist, for his induction as the 2021 SMA president. And the winners of the abstract competition will be announced. And there's money in there. What we all need to do is to go back to the meeting hub. The link is in the chat box. And then I think that last session will start up within just a few minutes. Thanks to all our presenters in all the sessions. And,
it's live. I'm just.
To our very wonderful staff.
No, we're not started. I just put on the room slides and stuff.
Almost flawless virtual meetings.
Okay. Well, we're just finished. Okay, go ahead and turn all your sound off because I'm about to.
All my sound is off. I muted everything off.
Did you turn that one down there off?
I don't know that it was ever off. Yeah, it says it's off.
Okay. Because I'm about to play music again.
Well, we didn't have any issues all day. So I don't know how I'm going from 57 to 59 made it work. So Dr. Bay. There's a drop in my room.
I swear it just got louder. Hey, Dr. Morris.
Hello.
Just talked with Randy, and they just ended theirs. So if you want to maybe just give just a few more minutes, see if anyone else trickles in. But other than that, we should be good to go in just a minute or two.
Yeah, 1 minute's probably good.
Do we have Dr. Hartman?
I don't think so. I'm looking for him.
Oh, there he is. Thank God.
Right?
Well, I was worried because you did give an assumed name yesterday.
I did?
You tried to. You claimed it.
Who did I say I was? I forgot.
Believe Hartman.
Amazing what that bourbon did to him.
Right? One sip and I'm gone. It was very good bourbon, by the way. If you ever have the chance to get that Blanton's Gold, go for it. And I would have shared it with all of you had this been in person.
Was it the French or the Dutch side?
Dutch side.
Okay.
Yep, we bought it on the Dutch side, and then we were told to go hang out on the French side because it was less touristy.
Well, they have a great pastry shop on the French side.
We had a great restaurant there, right on the beach. It was amazing.
So let's go ahead, get started.
All right. Welcome to the second general session of the Southern Medical Association. I now call this meeting to order. That's probably where I'm supposed to hit this. It is my pleasure and honor to introduce and install the Southern Medical Association president for the 2020 to 2021 year, Dr. Christopher
I'm
Morris.
gonna make you a co-host role for this one, just in case.
Dr. Morris, please raise your right hand and repeat after me.
I can make them one.
I, Christopher Morris,
I, Christopher Morris,
do solemnly swear that I will discharge to the best of my ability
do solemnly swear that I will discharge to the best of my ability
the duties and responsibilities of the office to which I have been elected.
the duties and responsibilities of the office to which I have been elected.
Thank you. Reposing confidence in the selection your fellow members have made and taking on the coveted role of past president, I hereby declare you duly installed as the president of the Southern Medical Association.
I agree.
Now, we're going to need some help from your wife on this part. Let me hand you this pin. Jane, are you there?
I'm here. Yeah.
Oh, thank you. Thank you for your help. We'll hand you your pin.
Okay. Thank you.
What did I put it in?
Go ahead and pin it.
Did he really get pinned? Oh, sorry. Bye-bye, Birdie.
Nice airmail there.
Do we do it like the SEALs where you slam it into their chest?
That's how they did mine. I think she should.
I don't know if you should give her any ideas.
Gee, guys, thanks.
Here, let them see it.
There, see, it's
You are
there. Right
welcome.
next, it's right next to Mickey. Hint, hint, hint.
Did you notice?
That's nice.
I handed your pin through.
Sounds good. All right. Well, thank you, Dr. Hartman, and thank you, members, for your trust in me to lead your association in the coming year. We have learned a lot from this year's coronavirus pandemic. First and foremost, it has confirmed that humans are truly social animals. We have seen an uptick in depression and suicide, in part because of being physically separated from one another. Many of us have tried telemedicine.
Dorothy Baker.
Admittedly, it has helped us provide care during these trying times, but I have not figured out how to palpate joints or perform joint injections via Zoom. Virtual meetings have become the norm this year. While the education remains excellent, I honestly miss the chance to interact with friends and colleagues I have made over the years at previous SMA assemblies. We have seen the importance of rapid dissemination of information on early diagnosis and treatment options for COVID. The approach has been multidisciplinary. Even rheumatologists with our expertise in immune modulating medications have played a role in providing appropriate treatments. In some ways, the changes we have seen are a microcosm of medicine in general. In the past, medical practitioners would discuss cases with colleagues at what was known as the curbside consult. Today, we rarely have the chance to interact with practitioners of other specialties other than the rare phone call. When I think back, I can recall numerous instances where a curbside consult really helped a patient. While technological advances and telemedicine have their benefits, the over-reliance on technological advances may not improve medical care, with one casualty being the physician-patient relationship. The Southern Medical Association remains a unique opportunity for practitioners from every medical specialty to come together and learn with each other as well as from each other. As a rheumatologist, I deal with diseases that can affect every organ system. As such, the benefits of a good multidisciplinary education help me provide my patients the best care possible. The SMA is unique in terms of medical education. We all have our specialty organizations, and their educational programs are certainly important. The truth is that my patients are not just one disease. They usually have multiple problems, develop other health issues that affect the diseases I
Are
treat.
you taking screenshots?
For this reason, educational programs SMA offers help me to provide more complete care to my patients. My first experience with SMA was as a resident, nervously presenting my very first paper in Nashville.
Hey, do me a favor.
The positive
Change
experience I had at
your
that
setting
meeting
to the
has
speed
led to
review
nearly 30
where it
years
is
of
big.
SMA assemblies and other programs.
Yeah.
My goal is that next year's assembly will be the best ever. I hope to put a program together that primary care people will get information that they can use immediately in their practices. We also need to strive to bring back the internal medicine specialists by ensuring that the program includes talks relevant to issues their patients face. Finally, we need to ensure the lectures will also provide valuable knowledge to the surgical specialists as well. I presented papers at SMA assemblies as a resident, then as a fellow. The confidence I gained from these experiences has stayed with me throughout my career. We need to ensure that we can provide a positive experience to today's trainees. The future of the SMA depends upon getting younger physicians into the habit of getting their CME through the SMA. This year, we have seen a significant jump in the number of papers that were presented. I will do everything I can to ensure that they have as positive experience as I had. I've had numerous experiences where a curbside consult over lunch with colleagues has benefited my patient's care. I hope that one program we can have at our meetings is a curbside lunch, during which attendees might be able to get some guidance on a vexing case they may have in their practice from other specialists in attendance. I believe that meetings are a great chance to learn away from the distractions of one's practice. For many, however, this means time away from the family.
Did you send that other?
My children grew up attending SMA assemblies.
Okay.
I hope that we can have our meeting at a place where families are welcome and provide access to family-friendly activities while the practitioner is getting top-notch CME. Not everybody can get away to our assembly. SMA has been expanding their educational programs available via their website, and I want to continue this. The lectures at our assemblies will be available to permit attendees a chance to go back and repeat a talk for reinforcement of the concepts presented. Additionally, we need to expand website-based topics to ensure that there is something for everyone. One idea I have would be to try and ensure that we have online educational programs that would fulfill at least some of the educational requirements for state licensure in every state of the U.S. I would like the Education Committee to take up this initiative this year. I would like the SMA to be the go-to place for everything CME. Over the past 2 decades, I have had over 150 residents perform rotations in my office. Trainees are increasingly expected to give presentations at meetings. This provides SMA an opportunity to provide a venue for such presentations. We need to continue to support our physicians in training working group led by Ms. Natalie Weiss and Dr. D'Antoine Smith. Hopefully in 2021, we will be able to get the abstract competitions we began planning last year back on track. As an added benefit, we could incorporate a job fair, providing practices and hospital systems a chance to promote opportunities in areas that are underserved. If we are able to draw trainees from programs located outside our region, perhaps we can bring some of them into practicing in our region. We are seeing a revival of various services available to SMA members. These perquisites add value to the SMA membership. Some of these include insurance and financial programs that can provide additional security to the physicians and their families. I hope that over the next year, these will expand even further. I urge you to go to the website to learn about the benefits an SMA membership provides you. The states covered by the Southern Medical Association are facing physician shortages that affect access to healthcare. Strong continuing educational opportunities can help to bring more practitioners to these underserved areas, as well as improve care given to those in the areas. A vibrant SMA can help with attracting physicians to the region, as well as helping to retain these same physicians. The SMA has leadership who believe in this organization and want it to thrive. We always welcome new ideas and new help. We would love all of you to help us with the renaissance of the Southern Medical Association. In short, I want everyone to know that SMA is the medical home for physicians who want to mentor, educate, and give back to their profession the priceless things they've learned over their time in research, academia, and practice. I want students and residents to know that SMA is their home as well, a comfortable place to present their work, to ask those dumb questions without fear, and to stay connected for continuing, non-biased, multidisciplinary medical education and peer support throughout their career. We also recognize the importance of the business side of medicine and the practice managers. I want practice managers to know that the SMA is a place where they can go to get clear and honest practice management advice and financial services. The place where medical and business professionals come together to learn from each other, support each other to ultimately make the American healthcare system strong and accessible. And lastly, the SMA family would not be whole without the SMA Alliance. It is very important to me that we reconnect these family members who were alienated through the course of reorganizing our governing structure. I plan to make time this year to speak directly with as many Alliance members as I can to figure out how to bring our best advocates back home. Doctors' Day, health education, and medical heritage projects are an important part of our future. SMA is my family of medicine, the place where I started and have remained connected to throughout my career. I ask you to join me this year in helping our family make our family bigger and stronger. Thank you all for being here.
Well done.
Bravo.
Hello.
Hi.
Great.
Congratulations, Chris.
Yeah, thank you.
Thank you.
Congratulations.
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 Oh, sorry.
Mazel tov.
I've been,
I just unmuted you.
okay, now I'm unmuted. I was trying to unmute myself while you were unmuting me.
I know,
So
we were getting there was getting some noise, and I just turned everyone off because it was getting too loud.
Oh, okay. I'm not going to touch that one. At this time, I would like to introduce Dr. Donna Breen. Dr. Breen joined the SMA in 1984 while she was a resident. She has been a member ever since. She enjoys the collegiality as well as a learning experience SMA has provided her over the years. To her, SMA is and always has been an organization with a small town atmosphere in that everyone is emboldened and encouraged to learn from experts and colleagues in a spirit of congeniality and overall relaxed learning experience. Dr. Breen values SMA as an organization where everyone has equal time. Every question has equal value, and everyone has the right to understand the concepts that are being presented. No question or thirst for knowledge is too little, and everyone is included in the quest for medical knowledge and skills in the healing arts. Dr. Breen is entering the office of President-elect. It gives me great pleasure to welcome her to this office and to say we are certainly glad to see you here, considering the Hurricane Delta that has been going through.
Thank you very much. I'm glad to be here. Thank you. Thank you, everybody.
Next, please join me in congratulating Dr. Lee Carter from Hickory, North Carolina as our incoming President-elect designate. Where is Dr. There is Dr. Carter. If any of you ever need to know which place to go for furniture, Dr. Carter is your go-to guy.
Oh, okay, great. Oh, you did. Ooh, thank you. Thank you.
Let's see. All right. Next one. I want to thank all the medical students, residents, and fellows who have submitted abstracts and participated this year in our digital poster sessions, and to all the medical schools and residency programs who supported their participation. With 130 submissions and 100 accepted abstracts presented today, our education committee and leadership had their work cut out for them to review, accept, and judge all of these wonderful submissions. The judging process was not easy. There were many excellent papers, and in many instances, the scores were very close.
Did they lose you?
Am I still here?
Yes, you are.
Yes, you
Oh, okay. Oh, I see. They're just putting up a new face so we can get rid of it. Oh, it's the awards thing. Okay. At this time, I would like to recognize SMA's Education Committee, beginning with our chair, Dr. Stephen Strode. Committee members, Dr. David Bell, Elizabeth Edwards, G. Walden Garris, Christopher Jackson, Michael Mackey, David Netcher, Glenn Talboy, Arrington Thompson, and Natalie Weiss. They did an incredible job, and I'm hoping that I'm looking forward to having even more posters and papers that presented or submitted for next year. A total of $3,000 will be distributed to today's winners from SMA's Research and Education Foundation as follows. The first place award recipients will receive $300 each. Second place award recipients will receive $200 each. Third place recipients receive $100 each. Keep in mind the scoring was extremely close, and it was within a snail's breath to find out who was going to get what. They were all very good. I think this was a fantastic day, and I think we all should be proud that what we had today. If you would like to support the future of education by donating to this foundation, please visit sma.org/donate. And if anyone by chance shops at an online place called Amazon, please shop using Amazon Smile and select Southern Medical Association as your charity. This way, every time you make a purchase there, a small amount of it will go to the SMA Education and Research Foundation. Now, on behalf of the Southern Medical Association, I'd like to announce the winners of this year's competition. Drum roll, please. Are we ready?
Can you hear it?
Boy, is that impressive. In session 1A, first place goes to Wesley Field, internal medicine resident, Department of Medicine, Northeast Georgia. Abstract was pain in the back, a case report of pulmonary sarcomatoid carcinoma. Second place goes to David Bowe, a medical student at Tulane University, roll green wave. Abstract title is An Uncommon Bacteria Causing Septic Arthritis, Streptococcus agalactiae. And third place, Laura K. Hansen, emergency room physician, and the title is Euglycemic Diabetic Ketoacidosis. Congratulations to Lace. Now we get to go to session 1B. In first place, ready, drum roll. Oh, well, so much for the drum roll. Oh, there it is. Next year, I'm going to bring my nephew. He plays, he drums with me, he's a drum player. First place is Jeremy Mark Hess, internal medicine and New Hanover Regional Medical Center, Wilmington. And the title is Hepatitis C Screening Disparities in America's Opioid Capital. What do we have to learn? Second place is Isabella Dreyfus.
Sorry.
Very good. Isabella Dreyfus, medical student, in second place. And COVID toes, the clinical correlation between chilblains and SARS coronavirus 2. And in third place, Case study of aberrant thin-arm motor branch in the median nerve discovered by carpal tunnel release by Tori Gargano. Congratulations on these 3 winners and excellent job. We move on to, did I just pass up? Yes, I did. Oh, session 2A. And again, with a very brief drum roll. First place for double trouble pulmonary venous thrombosis in the setting of factor V Leiden mutation. Second place goes to Aditi Vamuri in Davie, Florida. The effect of osteopathic manipulative treatment on a lower limb muscle rigidity in a Parkinson's patient. And third place, Askinia Sharasova, and that is apical Takotsubo cardiomyopathy in a young female with bipolar disorder, a rare case report. Well, that's better. I like that second one. And the winners in session 2B. In first place, Jeremy Morgan Watson, comparing the effects of radiotherapy and rapamycin in PIK3CA wild type and mutant head and neck squamous cell carcinoma cell lines. Second place, Nicholas Baltera, for in the nice southern area of Southampton, New York, a mesenteric desmoid tumor causing recurrent intermittent bowel obstruction. And third place, Anita Motwani, pardon my pronunciation, spontaneous bilateral ectopic pregnancy, diagnosis and management. Congratulations. And the winners in session. The winners in session. First place, Karishma Kataraya, anomalous left coronary artery from the pulmonary artery presenting in an adult with heart failure. Second place, Daniel Kittner, assessing the burden of COVID-19 on the mental health of internal medicine residents. And third place, Michael Anthony Petrangelo, the internal medicine resident, paternalism in the medically underserved patient, a case report. I want to congratulate all of our winners. I want to congratulate all our winners as well as congratulate all the presenters. You all did an admirable job. It was a great experience, I hope, for you. And this should hopefully make you all want to start getting your papers ready for next year's meeting. And so we are looking forward to it. This brings us to the conclusion of this SMA 111th Annual Scientific Assembly. Thank you again to all participants, attendees, members, and leadership who made this virtual event possible. We hope you gained new knowledge and enjoyed visiting with colleagues. See you soon. See you real soon.
Thank you, everyone.
Philip,
Yes.
I wanted to.
Hold on a second, Dottie. We're getting the music down. You want to do what? Thank you. That's what I wanted. Dang on it. How do I, there we go. I want to see who all's still on.
A lot of people.
I hung out since you hung out. I went and showed my mother my magic trick. And
Nice.
so I saw how you guys stayed on.
Well, what'd you guys think? Since I don't know that we had any kind of postmortem plan, but we happen to have everyone still on.
It was good. It was,
I'm
a lot of fun.
amazed.
It's different.
It sure was great.
I really appreciate all the participation. I'm glad we could all get to see each other, even if just virtually.
Go ahead.
It was a wonderful experience for a virtual meeting. Hats off to all of you who arranged it. Thank you so much.
Thank you.
Thank you
very
for
much.
joining us.
Thank you.
That's
And
right.
congratulations, Dr. Morris. Thank you.
Yep, start getting ready for next year.
Absolutely. All right. Have a good evening. Goodbye.
You too.
Thank you, you too.
Mandy,
Thank you,
look like
Randy.
the nose with the lighting, I hate to tell you.
Do what?
Mandy looks a bit spooky. There, you want to see Jane? There's Jane.
Oh, where's the, see, could she see the blue dog behind me?
Oh, yeah, here, you see there's a blue dog poster behind me. See? With Louis Armstrong.
To Donna.
Nice.
Donna, you see that one? If you look right over my shoulder, you'll see a very nice jazz festival poster. Louis Armstrong with a blue dog.
Nice.
Well, she knows
Thank
we're,
you, guys.
we're kindred spirits, Tulane wise.
Hey, it's
Well,
6:30
thank you
though.
all very much. And I hope we can, get together again sometime.
Yeah.
Thank you. Definitely.
Thank you,
Yeah.
Randy, for everything. You were
Yeah.
great.
You guys, this was fantastic. It
It
was,
was hard work.
yeah, it was really good. Staff did a great job. This was a lot of really different this year. I think this was a lot of fun, and I would call it a huge success. But I'm looking forward to seeing everyone too. Live, there's no substitute for a live meeting. So looking forward to seeing everybody, and hope you guys just stay safe until we see each other again.
Randy, congratulations to everybody, obviously to Chris and Donna. Randy, do we have any presumptive dates for, you say next year, but do we have any dates yet for calendars? Or if not, that's okay. I'm just asking.
I actually have some dates and some quotes on hotel rooms.
No problem. I just wanted to know where we were with that. That's
Yeah,
wonderful.
Let's
Let's keep our fingers crossed.
Yeah, I'm going to get with Dr. Morris probably next week and start talking about that.
Terrific.
Pick the date, get it set early, and hopefully everything will stay on the trajectory that it's going on. So.
Yeah. We'll have fingers and toes crossed. But I'll tell you what, this was unbelievable, and it was really outstanding, as difficult as it was, and it was not easy.
Good. That's great to hear.
And to the whole staff, I mean, Mandy, Kendra, gosh, things that you've done, behind scenes and everything. Thank you, Jennifer, by all means. And gosh, Dylan, you kept us on time. I mean, you had a little bit of things and you just fixed it. And I do appreciate all that you've done.
Well, I have to say that the leadership.
Dawn never put her face out there.
Are we moving your
I don't know why. Vicky Ball.
Oh,
She
she's
never
been watching.
turned on her camera.
All right, Vicky, you're being called out.
Well, I can't thank the education committee and the leadership enough for all of your support with all those abstracts this year. We could not have done all this without you guys. Y'all were
Absolutely.
fantastic support wise, and it's appreciated. You volunteer your time, and it's so much appreciated.
All the work on the abstracts, absolutely, in a short
was
time frame. This was a total team effort. So
It was,
thank you as well.
truly was, and y'all came through so big, and I thank you so much.
Great abstracts. Oh my gosh. I was really impressed with the quality.
Great.
Fun this year.
A wonderful meeting this year.
Yeah, thanks, Dr. Breen. Glad you're doing okay.
Yes.
I'm safe.
That's fantastic news.
All right.
Well, good night, all.
We'll call it a night.
Good night, everyone.
Good night.
Good
Hi, everyone.
Good night.
Thank you, Phil.
Oh, thanks.
Thank you.
Thank you.
Oh, well, okay. Okay.